Dr. Mel Lee. I'm the Chief Medical Officer of the Cedar Creek Medical Group, and we are covering sports injuries today. It's a tutorial, and we're going to be talking to you about some of the common injuries that you will see with tennis. We're covering a tournament that extends through June for a week, and starting on the 20th,
19th.
on the 19th. And basically the injuries that we'll be seeing will be acute injuries. Chronic injuries do cover the majority of injuries in most sports, tennis in particular. And the acute injuries we'll be covering will be ankle sprains and thigh strains. Those are the injuries that we can deal with and perhaps keep them playing. That's the objective of what we'll be doing with the sports injuries, with the up-and-coming tennis tournament, is we're trying to keep people in the tournament. Now, if you assess them and feel that they are unable to go on, you have to explain that to the patient and to the athlete, and have them get the appropriate follow-up and treatment at that time. We have, for our first injury, I'd like to cover thigh strains. These are fairly common in tennis and other sporting events. And what I'm going to do is show you how I would like you to approach compression dressing on a thigh injury. For taping or putting a compression bandage on a thigh, basically what equipment you need is a 6-inch elastic wrap, and then some of this self-adherent wrap, which is excellent, and maybe some sports tape to help secure the wrap on there as well. So when you're wrapping a thigh, you can either do it standing up, or I'm just going to do myself. Normally you'd be doing another person, but you go from the distal portion proximally. You're going to wrap. Initially put the wrap on just above the knee, and wrap it so that the end is secure. You can wrap it about once or twice there, and then what you're going to do is pull it snugly. You don't want it too tight, but so that it wraps about halfway around, and you go back down. You're going to do a crisscross pattern on the top of the thigh. You go up, and then you're going to go back down, and you're going to crisscross around there. You want it snug up to the groin, about 3 or 4 inches from the groin, and then come around, and then you're going to secure it with these little hooks here. Now once you've got those on, you can use the self-adherent wrap. This will help secure this on. This stuff's great. I wrap it around a few times. And again, you just wrap it snugly, not so it's strangulating the leg. And you can wrap it down on the distal portion too, because you don't want it sliding back up. So just wrap that around snugly. Okay, and then I'll take the sports tape, and you don't want it to go all the way around the circumference of the leg, because that'll cut off the circulation. So you're just going to put a strip across and a strip over here, just to make sure that that stays on there, and that should keep it on snugly. Elastic wrap, initially you go from the distal to the proximal, you wrap it snugly, and work your way up in a crisscross pattern, and then you're going to use the self-adherent wrap that will go around the center and go around the distal portion, and then you can tape that. Make sure you don't wrap the tape around, just to hold that securely on, and that should be snug, and they'll be able to participate in their sport with that on.